Good evening and welcome to the COVID-19 pandemic updates. I'm Kayode Okikulu. First, the highlights. Lagos State government to enforce isolation and testing guidelines for travelers as it monitors positive cases to detect variants. Taraba State government takes delivery of over 40,000 additional doses of the Oxford AstraZeneca vaccines. And India records over 20 million cases of COVID-19 amid severe oxygen shortage. But for the first time in a long time, Nigeria has successively recorded less than 20 cases over 2 days. The last time Nigeria had this range of cases was about a year ago when COVID-19 was still an epidemic and not a pandemic. But be that as it may, there is still a never-ending call for caution, so we do not throw the gains out of the window with our actions or inactions. So many lives have been lost to the virus and new variants continue to ravage countries globally. So as we approach what some have called the inevitable third wave, here's a breakdown of how far we have come.
India continues to battle a surge in coronavirus infections, which can put a strain on the country's health system. With over 20 million confirmed cases, India ranks second in countries with the highest number of confirmed cases and third in countries with the highest number of fatalities in the world. Globally, more than 153 million confirmed cases and over 3 million deaths have been reported.
More cases of COVID-19.
Meanwhile, the Director General of the World Health Organization says more global COVID-19 cases have been reported in the last 2 weeks than the first 6 months of the pandemic, with India and Brazil accounting for more than half of the cases last week. In Nigeria, the daily count of infections remains relatively low, with the latest record of 18 new cases reported by the Nigeria Center for Disease Control. The new cases were recorded in 4 states and the FCT. Lagos, the epicenter of the disease, recorded 8, while the FCT recorded 6. 2 cases were reported from Edo, while Rivers and Ogun recorded 1 case each. The new figure raises the total number of infections in the country to 165,199. According to the NCDC, no new death was recorded from the virus, leaving the fatality toll at 2,063. 10 people have been discharged in the last 24 hours, including 2 community recoveries in the FCT, managed in line with guidelines, bringing the total number of recoveries to 155,371. According to the latest update by the National Primary Healthcare Development Agency, 61.5% of Nigeria's target population have been vaccinated, with Lagos leading the chart, after vaccinating more than 90% of its target population. Ahead of the Hand Hygiene Day, the NCDC is advising Nigerians to pay more attention to hand hygiene through proper hand washing to prevent the spread of infectious diseases such as COVID-19.
Well, the ban on travel from India and 2 other high-burden countries is already in force as announced by the Presidential Steering Committee on COVID-19. But they are concerned about just how states will handle the strict enforcement of a 7-day self-isolation for all returning travelers and testing as well. Well, if states do not handle this end of the enforcement well enough, experts believe this might trigger a third wave with the importation of new COVID strains from inbound travelers, especially in a state like Lagos. Well, the state's Commissioner for Health, Professor Akin Abayomi, is however assuring that these protocols will be made more stringent. Passengers will now have to show a valid negative COVID-19 test taken within 72 hours of travel and must also mandatorily isolate for 7 days, during which surveillance team will visit to ensure compliance. Those found to have defaulted are liable to pay a stipulated fine in addition to isolation for 10 days at their cost. But there's more. Indigenous passengers risk the deactivation of their passports, while foreigners may be subjected to deportation. And over to Taraba State, where the Primary Healthcare Development Agency says the recent strike action by organized labor and resident doctors has hampered their desire to meet the set target of vaccinating over 50,000 residents of the state. The executive secretary in the state, Hassan Mafindi, says the agency has so far vaccinated over 23,000 residents and has also received an additional 40,020 doses from the National Primary Healthcare Development Agency, and that's to add to the 56,250 doses earlier received. But he's worried that people in the state are flouting the non-pharmaceutical protocols of wearing a face mask, social distancing, and the rest for protection against COVID-19.
The first phase of COVID-19 vaccination with Oxford AstraZeneca vaccine is still ongoing. Looking at the fact that at least Taraba State is coming from behind, and we have been able to vaccinate now over 23,000 people, and we felt we are not yet there. We just received additional vaccines from National, totaling about 40,020 doses, and now we have strategically deployed the vaccines for use in different locations. And we are working assiduously to ensure that we utilize that vaccines for the benefit of our people. And don't forget, we have also set aside the second shot, the second jab, for people that were able to access the first jab, which we are planning to commence by the special grace of God on the 22nd to 23rd of May for people to take that. Not until that is done, then we will commence the second jab. And I want to believe not until then that we'll know exactly whether we have the quantum of vaccine in the country that will serve the whole of the states for us to also assess ours to commence the second phase of the vaccination. We are no more talking about frontline health workers. We are talking about frontline workers. We have removed the health because we have successfully vaccinated almost 80 to 90% of our health workers. What remains now is frontline workers, which include media men, people from the NURTW, lecturers from colleges of different universities, colleges of technology, and what have you. So we have now categorized them under frontline workers. So we want to make sure that at least we give them the jab while we continue waiting for the second phase, full implementation of the second phase of the vaccination.
Well, there's still the challenge of vaccine hesitancy. Add to that the challenge of adherence to NPIs. But there's also another area which needs to be focused on, and that's, for example, how do you dispose of your face masks? Have you ever wondered how health workers handle all the materials they use in caring for their patients, from the PPEs to the shops, or as we call them, the needles and the rest? You see, this is an important theater of the battle against COVID-19 that needs a lot of attention, because failure to properly dispose of these very sensitive materials may open a back door to the virus, therefore triggering a chain of infection. So the question is, what's the right way to handle these sensitive materials, and how have we been faring? Professor Titus Ibekwe is a public health professional and otorhinolaryngologist, and he joins us on the program virtually this evening. It's good to have you on COVID-19 updates, and thank you for joining us. Well, let's first refer to the Taraba State case. Here we are again. For example, people are not adhering to non-pharmaceutical interventions. The PSC says that pandemic fatigue is setting in, but it will seem that this has always been the case. I know you're big on continuing medical education, so is there a model for handling this in public health?
Yeah, thank you very much. We realize that, waste management is generally a very big problem, especially in the developing countries. Worse still is to talk of management of medical waste. And now we are talking of COVID-19. We know that since the pandemic took the world by storm, we've been preaching that everybody should be using masks. So you can imagine the volume of masks that is used every day. Most of these masks are disposable masks, especially those that are used within the health facilities, hospital premises. And indeed, a lot of people prefer using the disposable mask. So, and you don't recycle. So think of the volume that is generated per day and how are these disposed of? So is a huge problem really, because if it is not well handled, that on itself is a very big health hazard. You talk of cross-infection, you talk of environmental pollution, and even environmental degradation. This can lead to even perpetuating the pandemic for a very longer period than the cycle would have lasted. So by and large, how these wastes are handled is very, very important. Ideally, they should be segregated and treated as hazardous waste, which they are, and handled also in a special way. Even people who are coming to dispose of this waste should also get protected on their own. But how are they used? They are disposed as household waste today because individuals just come back home and trash it anyhow inside their waste bin and dump it in the public waste, some even in open places. And you see people who walk around, the scavengers are trying to pick one or two things, just dipping their hands and feet into this. And even individuals whose responsibilities are disposing of this, they are mixed with domestic waste. So it becomes very hazardous to their own lives. Talk of the PPEs that are used in the various hospital facilities and indeed in the different treatment centers for COVID across the globe. How are they handled? So these are issues, these are cogent questions that need to be answered, not to talk of the sharps, which you use on daily basis. So attention has not really been so much focused on these areas. We've been talking of people protecting themselves, but of course, this is the time to discuss this issue because the environment has to be protected and we have to protect ourselves to curtail the chances of reinfecting ourselves and reinfecting people around us, because this is the easiest way of propagating this disease further. Well, once we've been able to break this chains of infection and transmission,
right,
then we're able to go ahead and have our vaccinations and stick to the guidelines for protection. Then you will know that possibly the pandemic coming to an end is at sight.
Well, if you could, Prof, can you just paint a worst-case scenario for us if things are not done the right way, if these items are not disposed of properly? What is a worst-case scenario?
Yeah, the worst-case scenario is reinfecting ourselves and propagating this disease the more, because we're talking of like the mask that we use on a daily basis. The mask is like a breather. We exhale and inhale on this, and indeed, for those who are infected, these organisms are trapped by the mask. So you have millions of it, which you cannot see with naked eyes that are in this mask, and you just dump it carelessly. So the chances, remember, even till tomorrow, we're still talking of aerosol form of infection as far as COVID-19 is concerned. So it's something that can be easily propagated.
Okay, I think we lost the Prof right there in the middle of his response. But I mean, I think the point has been driven home that these, materials, sharps, face masks, PPEs need to be disposed of properly, and there needs to be proper enforcement also by government. But we'll go on a break now. When we return, we'll bring you some analysis of recent trends in COVID-19 infections across the globe, plus a certain meeting of heads of state and governments from 8 countries. We'll tell you what came out of that in a moment. To join us again. Heads of state and governments from 8 countries have participated in a roundtable discussion to build a stronger multilateral system for pandemic preparedness and response for the future. Well, the co-chairs of the independent panel, former Prime Minister of New Zealand, Right Honourable Helen Clark, and the former President of Liberia, Ellen Johnson Sirleaf, presented its initial findings on how the current international system failed to protect people from a devastating pandemic.
While the pandemic has highlighted the value of partnerships, it has also demonstrated the damaging effects of unilateral action and unequal access to resources, life-saving resources. We cannot hope to overcome this pandemic for as long as richer countries have most of the world's supply of vaccines to the exclusion, but also more importantly to the detriment of poorer countries. As we prepare for future pandemics, we need to accelerate efforts to realize universal health coverage. We need to ensure that vaccines and other life-saving treatments are seen and considered as public goods by the world.
All countries must maximize their use of public health measures to curb transmission of COVID-19. The roles of you as leaders are vital in conveying to populations that this is a life and death matter.
Well, if you've been following the conversation around the world concerning vaccines, then you will have come across talks about vaccines expiring. In fact, we've seen some countries destroying expired vaccines, ironically at a time when vaccines are in short supply. So let's talk about the science behind all of this. And Dr. Peter Moise, a research fellow at the University of Aberdeen, specializing in molecular science, joins us on the program. It's good to have you, Dr. Peter. Now, clearly we know that vaccines really expire, but for those who are probably planning to get their first jab or those waiting to get their second jab, and they hear this talk about vaccines expiring in July, June, especially for Nigeria, there are a lot of questions. So let's try to answer them. First, what might happen if a person gets an expired vaccine, for example? Let's begin with that.
Thank you for having me, Kayode. Basically, when it comes to expiration of drugs, it's not a peculiar situation when it comes to COVID-19 vaccines. Like you know already, all drugs or most products you have in the market, they have expiration dates. Now, when you have a drug that is expired, let's say in this regard, COVID-19 vaccine, each of these vaccine has a shelf life of 6 months to start with. So after that particular expiration date, you are meant to discard those particular products because the component for which these particular products are made are kind of time-based. So once that particular time of preservation elapsed, then it's no longer effective. And when it comes to the COVID-19 vaccine, it will not be efficacious when it comes to achieving the end goal, which is trying to trigger off the immune system in the individual body.
So it appears as though that's what a lot of countries are looking at. That's why they're destroying it. But for those waiting to get their second jabs, and I mean, seeing what's happening in India, for example, there are a lot of countries that are not sure where they will get their next batch from, because India is, of course, as you'll expect, keeping those vaccines closer to home. So in the eventuality, maybe not, that a person misses the window to get a second jab of the AstraZeneca vaccine, for example, what is the implication of that?
The implication of getting a first dose and not the second dose is just that you're going to have a reasonable level of immune protection. And that particular level of immunity, I think for the Oxford AstraZeneca is somewhere around 50-something%. So if you miss the first dose, it means that you do not really have the full cover, but you do have a reasonable level of immunity going forward. But when you go through the route of the clinical trial phase, which was done by the Oxford AstraZeneca, you are meant to give the first dose and the second dose. And based on that, you have the covering of about 76% efficacy. So that's the reason why you need to go for the first and second dose. And basically, I think when it comes to countries where you have low number of doses, clearly what you should do, for instance, in Nigeria, I'm aware that we have about 4 million doses basically. So really what you need to do is to preserve the 2 million doses to be sure that once the second dose phase kickstarts, you have the right vaccine right there for you to administer to your population. Rather than administering 4 million doses, then you're not so sure where to get the next batch of doses when it comes to Oxford AstraZeneca. Because India, where we get the COVID from, is currently in a mess right now.
Well, I think that's clearly the plan the MPHCDA is adopting, because just so far we've vaccinated 1.23 million with the first jab, and that's about 61% of those intended to get that. So I believe the plan is to have the other at least 2 million to get the second jab. But let's talk about antimicrobial resistance, because that's something that has also come up in this conversation about I mean, the virus shape-shifting, what happens in the future? And people are asking, so once they get the first and second jab, what are the possibilities in the future? Will there be a need to maybe get further? Because I know the WHO has been speaking on this. The NCDC had a meeting as well over the past couple of days. So in terms of antimicrobial resistance of the virus, what do we know so far?
So this is a virus, so I won't regard it as antimicrobial resistance. So the issue here we are not so sure of is that once you have, let's say you have the first and second dose, basically, if you draw inference from the previous coronaviruses we know, usually when it comes to the level of antibody immunity you have, it kind of win out within 6 to 12 months. And recently there are publications already here in the UK where Imperial College did a study recently where they show that for the ones that you get, that is the natural immunity, is somewhere around 6 months. So basically, we're not so sure how long this particular immunity we get from the vaccine is going to last for, because coronaviruses behave the same. So what we need to do is we need to keep a tab on the people we are vaccinating. And that is where I have a slight issue with what is going on in Nigeria. So we've vaccinated for the last 5 weeks. So what I should expect the NCDC to do, or the National Primary Healthcare Development Agency to go ahead to do, is to track the individuals that they've vaccinated already, take their blood sample, and see if these individuals are actually generating the antibody you're looking for. And once you do that, you track these individuals for a period of 6 months to see the level of antibody efficacy they have, because we know that this particular immunity may likely wane out. So you need to be sure, first, are your people generating the right immunity you're looking for? That is the first question you need to ask yourself. Second, how long will this immunity last for within our own given population? When you look at the pandemic, clearly you know that the way this pandemic has behaved, it has behaved differently across board. You know that when it comes to Nigeria, we're not really adhering to the non-pharmaceutical interventions. And based on that, you can still see that the cases are actually dropping on a daily basis. I know that may be tied to the number of testing we're doing. But once you infuse this arm of research into your vaccination program, you can be able to tell if your individuals are actually generating the antibodies you're looking for, then how long this particular antibodies will last for. Now, when it comes to resistance, where you have issue with resistance is, for instance, the Johnson & Johnson is developed using adenovirus 26. And that same platform is used for the Ebola virus, Ebola vaccine you have, I think, in Democratic Republic of Congo. So the only issue you have from a point of molecular biology is that if you have, so for adeno 26 virus, which is the weakened virus, so used to develop, deploy the vaccine, it's common among humans. It's a human kind of virus, flu virus. So if you then bring in this current COVID-19 vaccine, there may be likely cross-reaction because the body already knows that the body has immunity already against this sort of viruses. So when you bring in the adeno 26, there may be cross-reaction there. Now, when it comes to the AstraZeneca, this is more like chimpanzee and it's weakened virus. And basically, you're only using it for just 2 phases. So the only problem is if in the 3rd phase where you're trying to do the booster dose, we're not so sure yet if that's going to create a cross-reaction because your body is already aware of this weakened virus. Right. Whereas after a few lengths of time, if you introduce a new product into the system again, there may be a cross-reaction here and there. That's just the science which is still ongoing.
Well, Dr. Peter Imoisi, always a pleasure to speak with you on this topic.
Thank you for having me on your program.
Well, the number of COVID-19 cases in India has crossed the 20 million mark, despite the government saying the cases are slowing down. Now, over 355,000 cases were added today, though slightly lower than the 400,000 cases reported on April the 30th. Here's more on the Global Update.
The Indian Health Ministry confirmed that the COVID-19 caseload has surged past the 20 million mark. In the past 24 hours, more than 357,000 cases were added, taking the total count to about 20.3 million, while deaths rose by 3,449 to hit 222,408. The South Asian nation has now reported more than 300,000 new daily COVID-19 cases for 13 consecutive days as the epidemic continues to devastate the country. Philippine President Rodrigo Duterte has received his first dose of the Sinopharm vaccine against COVID-19 to encourage reluctant Filipinos to get inoculated and help stop the spread of the virus. Footage from the government broadcast arm, RTVM, showed him being inoculated by the Health Secretary, Francisco Duque, inside the presidential palace.
But don't forget to protect yourself. The virus is still very much out there, and continue to take responsibility. And don't forget to visit our website, channelstv.com, where you can get updates and a better understanding of the pandemic. We also have all the big stories from politics to business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update for today. Thank you for watching. I'm Kayode Okikule.